All right, Dr. Chris. Well, welcome to the Unfiltered Healing Podcast. We're excited to have you on today.
Oh, thank you so much, and I really like the name, Unfiltered Healing Podcast. I really dig that name, but thank you for having me. It's really great to see you and get to call and catch up, and about all things health.
Yes, yes, and um I'm really like passionate and excited about our conversation today
Mhm.
because the topic of I'm sure we'll talk about various different things, but really the topic of Lyme disease is one that is not there's not much hope when that, diagnosis comes into play. There's a lot of confusion around it. There's a lot of, um, just hard topics around the topic and concept of Lyme disease. So this is why I'm excited to give people a perspective of, hey, we're two doctors. We've had it. We've overcome it. Um, and
Mhm.
I think that gives a lot of hope to people to be encouraged that there is availability and answers pretty much for most everything, right? So I'm excited for this
Mhm.
conversation too, because I think people need to actually see examples of people that have overcome it. That really helps when you're in that season. So why don't you talk a little bit, introduce yourself, and talk a little bit about yourself first? You know, what maybe got you into healthcare? Because I know that you do different things in your practice, in your holistic practice, but you do focus on Lyme disease as one of those tiers as well. So, what started?
Yes.
Were you always passionate about natural health? Is it kind of something that you fell into, or what happened with that?
I think it was something I fell into really. I know we haven't really like caught up since the last time we saw each other at that methylation class. But
Yeah.
I remember when I was younger, I didn't really plan on. I had an idea that I wanted to do health, but when I was younger, I had a few thoughts. I thought I was going to be like a jet pilot. I thought I'd be an artist.
Mm-hmm.
Those are the two things. And then my brother, start off, my dad was supposed to have back surgery, and my dad's supposed to have low back surgery, and he avoided it by going to his chiropractor. And my brother had allergies where he had dust mite allergies. He couldn't breathe through his nose. So he he got inhalers all the time, and he
Mm-hmm.
had shots. And so then he went to this chiropractor, my dad's friend, and got some things adjusted, and he started breathing through his nose again. And I was like, that's pretty cool because I stayed in the same room with my brother, slept in the same room. He'd
Mm-hmm.
keep me up all night the way he would breathe. And then he started breathing through his nose, which was normal. And I couldn't believe it. So that kind of put that into my head. I thought that would be really interesting to help people when I saw them do what they were doing, like on my dad's back and on his spine and on his arms and legs, and to
Mm-hmm.
help people in that manner. So was I did I fall into it? I think I must have because whenever I got into high school, I didn't know why, but it always stuck in my head that I think I want to do healthcare. And so I didn't really want to go to the military because they were going to tell me everywhere I needed to go, like what location. Fast forward, I did go to Cairo school and Chiropractic University and majored in Chinese medicine and kinesiology, and then focused primarily on that. And when I started practicing, I was doing some, herbal work, and my mom would say, "Hey, your uncles do that in the hills of Korea." And I was like, "Really?" Because my mom's from Korea, and so I was like, "My uncles, the great uncles, distant cousins, some of them did that in the hills where my mom grew up." And she was like, "I was like, why haven't I ever met them?" She's those guys are kind of weird. They're kind of crazy, but they up there healing people. And I was like, well, maybe it's in my blood, like to have that in there. And so my
Yes.
grandfather, my great grandfather, they did Tai Chi and Qigong, and my mom said they did that kind of stuff outside in the backyard. So um, it was always something that kind of stuck in my head. And then as I progressed in it, then that's when we were talking about you and I, like when we've had Lyme infections, we have Lyme disease, and we've had those things that you go through. And I guess you get prepared. You go down the route and you're like, well, I'm going to have to experience this because somebody else is going to feel the same way. And we're
Mhm.
going to have to help somebody that's gone through the same thing. And I know you as well as I mean, many times people come to me, like we're talking about Lyme disease. People will come, and I never ever touted or said that I am treating people with Lyme infection. In
Mhm.
fact, we're very careful about what we say. It's like, I'm just helping people to help their bodies strengthen up to help them fight the infections if we can. But after I had it, it seemed like everybody was coming in with Lyme disease, and I was like, good heavens, I didn't advertise it. It's just more people knew, and there was that attraction there. So with all that to say, I was very thankful that I feel like I was placed in some way in this path, because I never really knew why I was drawn to healthcare, unless it's in my blood, unless it was like something that pulled me and drew me to it. So yeah, that's the quick and easy avenue. But another thing, guys, I'm in Nashville, Tennessee. I've been practicing for about 17 years, almost 20, and definitely work with people that have Lyme disease, parasites, yeast, mold, work with emotional instabilities. We do methylation with liver toxicities. We treat everybody from a day old. I know you do too, up to like over 100, and been doing it for a long time, and I've seen really good results. Not pat myself on the back, but just thankful how the body heals itself and how you can see and progress the body. So that's where I'm at. So I'm still rocking and rolling. I still practice. Have a podcast and have my website and Instagram and things like that. So check me out at Dr. Motley. And I'm not trying to get you to follow me. I just, wanted more info.
Yeah, we'll plug it at the end, so people will have that at top of mind at the end of our time here. Yeah, it really, I mean, it is our calling. We don't really think of it in the sense when we're going through it, but it definitely is a calling,
Mm-hmm.
and a lot of natural doctors or just doctors in general. That's typically how we get into these things. Not always, but we have an experience with it. Now, with when you got diagnosed with Lyme, so what was your journey with that? Was that in school, after school? Were you practicing at that point? When
It
did
was
that?
actually before. Yeah. Yeah. When I was, okay, so I was about 13, 14 years old. And so I, I had a dog, a pup. His name was Hercules, basically. Had the dog. Couldn't find him one morning. So we lived out in the woods. And so I was one of those kids that loved to go in the woods, and I would just go running around. And then couldn't find him. So I went down deep into the woods behind the house, couldn't find him, came back up, went through a brush pile, got up
Mhm,
to the house, and I looked down. There was dirt all over my legs. So I was like, I'm taking a shower. So I started trying to scrub the dirt off, and it wasn't. It was sea ticks and nymph ticks. So that
mhm,
was around 13 to 14 years old, and there was probably, I counted them. I was, I'm a science or math nerd, so I counted them. There were about 60 of them on my legs.
dang.
Probably about 25 to 30 of them had attached. From that moment on, I didn't put two and two together, but I started having where I was having insomnia. I
Yeah.
started feeling like things crawling up and down my legs inside. I started getting really bad insomnia, had horrible digestive system even when I was a kid from yeast infections. And then I started having muscle weakness where I used to be really fast and can jump pretty well, and then I
Mm,
started losing coordination, brain fog, hands started sweating all the time. My feet started sweating all the time. Unexplainable. Like I just felt nauseous all the time. And then it sort of subsided. I don't know how yours, I'd like to hear yours, because like your story, because like mine subsided. Um, I say subsided towards college, towards undergrad, but I was always tired. And then I went to Chiropractic University, and then um, again, chronic fatigue, always like in that like brain fog state, but still finished pretty well. And when I was in practice, I was in practice for about, I would say about 5 years. And I pushed it hard, worked every day, like you and I. We were just talking about how we worked all full days. And I remember working on a patient, and I was doing a certain maneuver on their neck, and I felt this numbness go up my arm, up to my head, and almost passed down on the patient.
mhm.
And I was like, okay, I just dehydrated. I haven't eaten. I would drink 3 or 4 lattes, ventis a day, to keep
Sure.
me going.
Yep.
And not proud of that, but that's how you do. You try to keep going.
Yep.
And I went, and one of my patients was a nurse who was out in the waiting room. She goes, "Hey, you might sit down. You don't look too good." Thought it was nothing. And then from that moment on, I was pale and gray, and I started having all the symptoms. I had vision problems, had
Mhm.
migraines, had hearing problems, chronic jaw pain, chronic migraines, heart palpitations that would beat out of my chest and wake me up at night. Those kind of symptoms. Leg weakness. I didn't think I was going to practice. I almost stopped practicing because my legs were so weak from standing. I couldn't do that,
Mhm.
and my vision in my head got so bad I couldn't think clear. I was down to seeing about 4 to 5 people a day, and from that journey, if you guys, this is the redeeming part of it. I was at a conference, and I remember going to the conference, and one of my friends, Dr. Alan Lindsley, who is a big Lyme's doctor up in Wisconsin, he's Nature's Pharmacy. I'm going to plug him. He's awesome. He does great work.
Mhm.
And he saw me there and he goes, man, this is not just adrenal fatigue, man. And I was like, okay. So he went and I went up to his office. He did his examination check. He goes, man, you got Lyme disease, man. And I was like, really? So he started the treatment protocol. And man, it got it good. Like back then, it was just like I was like hit it hard and do it as much as you can. But I was herxing sometimes, you know.
Yep.
But I did that, and you know how it is. Like and from that point on, I was like, well, I kept on healing, and I got rid of a lot of my symptoms. I was actually going, hey, I don't have a chronic migraine today. To the point where, have you ever had this? Like your head felt decent after you done, you know, you work and you go, am I having a stroke? Like I would, because my head felt lighter because I thought it was
Yeah.
good.
Yeah.
When that started happening and more days became better, because people say you can't get rid of Lyme and don't have hope. And I was like, well, I'm not having the symptoms. And then my legs didn't get better. So my legs stayed weak. And then I talked to Dr. Miller, Dr. Nancy down in Dallas, and she was doing more, her and Dr. Buckley, like down in Dallas, and they were like, you may want to look at your methylation. And so Dr. Miller was doing methylation. She showed me that, and I was like, what? And she's talking about all the pathways we talked. You know, we see like with all your methylation within your liver, how your liver can detox all the infections and raise your immune system. And so I did that, and after about 3 months, and I was like, I would be standing working on people, usually leaning against the table, and it wasn't the smartest thing to keep on working when you don't feel great, but I just kept rolling, and then I was like, huh, I stood up for it most of the day, and I don't feel too bad.
Mhm.
And then I kept on using supplements, the minerals and vitamins with the methylation treatment. And I was like, oh my word, man, my legs are gotten stronger. So when people say you can't heal from Lyme or can't move through it, it's not because that you and I are trying to say anybody out there's listening have hope, because
Yeah.
it's coming from a standpoint that when you don't feed your genetics, if you don't feed what you particularly need, you may stay in that rut where you think it's never going to get better. But I'm living proof, and you're living proof too, Doc. Like whenever you do the right combinations for your body, you can see great results and go through it.
Yeah, and Lyme is one that's just so tricky. I mean, we could probably talk like hours on all of the ins and outs of Lyme, but I mean, first off, there's the part of each one of us are uniquely different. We each have a different biochemistry. We each have a different immune system. And so
Mm-hmm.
depending on that, that's going to depend on what symptoms we actually have. Um, and then the treatment, for instance, is can also be uniquely different. There's so many aspects of this infection. For myself personally, I never knew I was bit. So for me, it was, and especially where I grew up and where I was at, it's getting more steam now, but we didn't even know what Lyme disease was. I
Mm-hmm.
I didn't know anybody that had it. And for me, it was just, I had it when I look back, I think I had it when I was younger, or been exposed to it younger. But, it wasn't until I was, like, 18, 19, and I went into college and, I had more stress load and things of that nature, and then I just passed out. And, I passed
Mm-hmm.
out, I went to the hospital, and they're like, "Oh, your blood sugar is just really low. So, do that." But I can tell you from that moment that I passed out on however many years it took me to heal, I never felt
Mm-hmm.
the same after that day. It was just like, that's what cracked it.
Mm-hmm.
Um, so
Yep,
yeah, yeah. So, at that point,
that's exactly what happened to me too.
yeah, it's just like you
Yep.
hit your breaking point, and then it's like, whew, nothing feels the same there. At least for that period
Mm-mm.
of time. So, I got diagnosed with a virus called Epstein-Barr virus, which most Lyme people have as well. And that was basically attributed to all of my symptoms for a long time. They're just like, oh, you have Epstein-Barr, you have Epstein-Barr, you have Epstein-Barr, you have Epstein-Barr. Um, and then I just started getting a lot of, weird symptoms. What affected me the most was definitely my heart function because of Babesia was the hardest one for me to get rid of, or
Oh my God.
the longer lasting one. I
The
went
one
through,
that's the most stubborn. Yep.
yeah, um, I went through the Western route, unfortunately, first. This was before, we knew a whole lot. And
Mm-hmm.
did couldn't find out what was going on, and so it was with the help of one of our local mountain men nature paths that he suggested maybe Lyme. So I did, the testings, and at that point it was like such deep depression because I had heard that we can't get rid of Lyme, and like it's so after I knew what it was, I was like, oh my gosh, like you know. So there's a huge emotional
Yep.
component to these things. There's a huge toxic emotional component to these things. Um, so I went through the
Mhm.
Western route, went through all of that, learned about all the corruption with that. So, when we think about corruption of what's going on now, we've experienced it in the Lyme world far before now. Um,
Mhm.
took a long time just to get the testing done. And then I just honestly, with antibiotics, I got sicker and sicker and sicker and sicker. So, that
Mhm.
being said, I did a lot of natural treatments at that point, which pulled me into going to chiropractic school and then, yada, 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 several years of different types of natural remedies and things of that nature that got me to the point of complete healing. Methylation was definitely
Mhm.
one of those pictures, but I'd say at the point of methylation, I was pretty much done with Lyme, thankfully. It was just
Mhm.
severe energy ATP mitochondria deficiency. So, all the
Mhm.
years of
Mhm.
antibiotics, all that nasty stuff. So, um, that being said, my journey is a little bit different. It kind of that led me into health because I got to a point where I had exhausted what was available to me. So I was like, well, I guess I got to
Mhm.
go to school and I got to learn some things because I've kind of exhausted even the natural parts of where I was at, which all helped me to a point. But there was still
Mhm.
some things that I was struggling with that I didn't learn till after I became a doctor of chiropractic. So long story short,
Mhm.
uh, kind of a different route, but yes, led you into to the calling and the part where you're at, and that's huge because you have to have empathy for these people because you've been through it.
Do you find it though, Doc? Yeah. When you go through it, have you found that whenever you went through that and you went through school to get your healing done, like more people were attracted to you that already had that condition? They were like already coming to you and they didn't even know you had that before and that was already coming towards your door.
Yeah, I'll be honest at first, when I first started practicing, I didn't wanna treat Lyme people. I was like, "I don't
You
wanna
didn't
be."
want to treat live people, huh?
When I first graduated, I was
Yeah, all you guys are listening. We love live people. We're just like
oh,
that's
yeah.
just. I mean, wow.
Oh, yeah, I treat tons of people now. But at first,
Yeah, me too. Yeah, but
there
you
was
didn't. I mean, it's a tough case.
it
It's
was
very tough.
tough.
Is that why? Because it's for Lyme. It's so tough.
It's tough, and there was a lot of, like, unprocessed stuff that I hadn't worked through at that point, and that's a huge part of overcoming anything chronic too, is digging into those things, but, yeah, for a while, I mean, I didn't really wanna deal with it, it was kind of still too fresh for me, and it wasn't until, I don't even remember how long it took me, but then I started being like, "Hey, I actually do have answers for this," and I started seeing people, and then, of course, once you see someone overcome something in any type of condition, they refer people, "Oh, I know someone who has that." I get people all the time, actually, I'm sure
Dr.
you
Rachel has the answer.
yeah, I'm sure you get people all the time messaging me, "Oh, I know this doctor that overcame it," or, can you give any tips?" or whatever it is. So, yeah, it's attracted to you. And I know you because I don't even promote Lyme much in my social media, but I know you do quite often. So
Yeah.
you must now really target that community. How much of your practice is devoted to that?
I would say if it's like 100%, I mean, like in that realm, I would say about 60 to 70% of my practice is Lyme disease patients. And
Wow.
it's one of those, like you just said about how you have people that come in, and those of you out there had it or are battling through it right now. The hardest part is that when they do come in, and you suspect it. I've geared myself not to just go look for Lyme
Yeah.
like in the practice, like always looking for Lyme. I don't. In fact, I almost go opposite. I always go look into like different if there's any viral infections or SIBO or strep or
Mhm.
even some parasites. But I do think we hit it nail on the head whenever we see somebody that comes in and I get all the indications and all the testing I do is like showing you like 7 different strands of Lyme and you're like that like
Mm,
you just said, like you say, treating those individuals when they come in, when a person with Lyme, when really bad Lyme comes in, you realize like this is a journey, and this is like literally a health change for that person's life. And anybody's listening out there, like we know, you and I both know, Doc, like
yeah.
how hard it was to struggle. In fact, like you were saying about like going through the emotional aspect. I remember when I was battling Lyme, I did not want to hear about Lyme disease. I didn't want to talk about it. I didn't want to read anything about it because I had done so much research and gone through so much treatment that I was like, I almost compare it to like if you had a bad relationship. You
Yeah.
had a bad boyfriend or a bad girlfriend. I went through a whole series with this person. I don't want to hear about their name. I don't want to think about it. And you go, only for about a year or two after, I started going, okay, I can read more about Lyme and like
Mhm.
and new testing procedures and such. So that's about that many, about 60 to 70%. Now the good thing is my approach has been very mild in the sense like I try to hit it hard, but you
Mhm.
know as well as I know that basically I want to make sure that people detox in a safe manner. And in Chinese medicine, what I try to do with the Lyme patients is try to build their energy, the
Mhm.
mitochondria and ATP. I try to build their organs up as much as I can while doing a little bit of kill off.
Yeah.
And I know that when people come in, they're like, I don't want to go through another detox because I'll hurts bad and I'll have, shakes and tremors and have all these things.
Yeah.
But we've had really good successes. Now, I'll say this, though. There's a few patients, and I'm very cautious. You and I know that whenever a patient comes in, they have really severe. I have other doctors I do know that do different types of Lyme treatments. And if they need something a little more like intravenously or something like that,
Yep.
go right over there and see those individuals.
Mhm.
I'm not too proud to like say no. They're going to hit it harder and do it better than I can. But
Yeah.
I'm thankful that you and I, when we go through our experiences, to know how somebody feels. That's the reason people come to. That's why they come. It's not because like I do better work than the person down the road, or I'm serious. Like I respect people in my town that do Lyme work and all around the country. But
Yeah.
it's more just like people go, you understand what I feel like, and
Yeah.
that's and I understand. Like I can tell them how long it's probably going to take. So I mean, same. How about like do you usually see a lot more Lyme or more parasites? Or I'm not trying to get us off subject, but I mean, do you
Yeah.
have like a predominant amount of Lyme, or do you have just
Um,
methylation in your practice?
I see, like, such a wide spectrum of things in my practice, but I would say I don't necessarily go search for it either, and that's 'cause of
Mhm.
my own history too with when I first found out I had Lyme, which we can talk about testing for Lyme too in a minute, but, when I first found out, similar to yourself, it was like, "Okay, we found the infections. Let's kill them, all the time. Keep killing." Um, and I just got so sick, and it doesn't matter if antibiotic or herbal or whatever method, because I have people that don't do antibiotics and they just kill, 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 kill too, and they are worse. And so, there was kind of a group of people for a while that would just say, "Oh, that's a Herxheimer reaction," which is what typically is called that die-off or detox reaction after you kill some of these infections. And I just fed into that. I was like, "Oh, this is good. Like, I'm killing things, and I just feel awful, and I can't get out of bed, but it's good. I'm killing things." You know? And, this is what many people come in and they're told, and they just totally depleted their energy and their mitochondria, and yeah, that's the process of learning is going through this, and I I am thankful in a sense that I've done so many different types of treatments because I can know and I can say, "Oh, yeah, this is what's happening," and I can go back to the start with these individuals, and my first goal, even if they have Lyme and I tell them when I screen people that come in for, like, nutritional stuff, I say, "What I'm gonna do is I'm gonna screen everything. I'm gonna screen if there's infections, I'm gonna screen if there's toxins, heavy metals." I said, but we're not gonna do all that stuff first. I just wanna get a picture of what we're dealing with. And I want you to
Mhm.
understand and get a picture of what we're dealing with. But does that mean we're gonna go after Lyme and all of that stuff right away? Absolutely not. there's probably other things that we need to deal with first. Um, and I think that's encouraging to people because, I can tell them, "Hey, these are things that we're dealing with, and this is why you feel that way." But it's also not like, "Hey, we're just gonna go into this and bust through it, and you're gonna feel awful." But it is definitely a longer journey. I would say with Lyme, I find that the parasitic infections, and one of my actual Lyme mentors, when I was getting treatment from him, like over a decade ago, he would tell me, that, like, protozoal infections and parasitic infections, like Babesia, which is a parasite, are oftentimes way more difficult and, symptomatic and harsher than actual, Lyme or Borrelia infections, and I've kinda witnessed that in my own personal, treatments with patients, like when we do parasitic infection cleanses, or it's part of their protocol where we focus on parasites. Oftentimes, a lot of the other co-infections will come out too with that process. So, yeah, I don't know if you find that in your practice as well, but that was.
No, it's exactly that. Totally. Like I had, I mean, I had Babesia was my highest one. So
Mhm.
Babesia was really bad in my brain. I diagnosed, I mean, I screened for my mom, and my mom, I found parasites on her, and I was suspecting protozoa parasitic. Got
Yeah.
a blood test, standard Western blot, standard blood test from LabCorp, and they found high amounts of Babesia
Wow.
syncani on her,
That's
like
pretty
just a whole
impressive
bunch,
for my
and
test.
she was saying so high. Like, yeah. And my mom had, she had stroke issues. And they say one of the main symptomatology that can come from that is stroke. Because many of you out there, when you listen, like you may already know Lyme, but Lyme and all its co-infections are blood parasites. And the hardest part is that when the blood parasites get into your red blood cells, they'll eat up all the proteins, the hemoglobin,
Mhm.
and then they eat it up, they multiply, they get big, and they pop open your red blood cells, and then your red blood cells can't attach to iron. Then you can't absorb oxygen because the iron's supposed to attach to the oxygen. So people get anemic, and then they get sick, and then have Epstein-Barr virus going around. And then when I had seen that more and more with patients, you say, look at parasites. You're right. I find that oftentimes I always tell them that there's a layering, and we all talk about layers like an onion, but it's the truth. And
Mhm.
to me, it's dumbfounding. I don't say this like I'm talking. This is like conversation. This is great. I love talking with other people who do what I do. I
Good.
think it's the hardest thing is that whenever you see like a person with a Lyme test or a screen, and they know they have high amounts, but for some reason, the body will present other things as
Mhm.
necessarily not saying more important, but it's like it's a
Priority.
balancing act. And I always try to. Do you ever find that, Doc? I always consider it like I always say like my iPhone. I say, okay, what if you had 7 apps running on your phone, and you have one of those apps is Lyme or Babesia,
Mhm.
but there could be another app that just keeps draining your battery, and I go, that could be a tapeworm. That could be Epstein-Barr virus. That could be cytomegalovirus. That could be hidden chronic bacterial infection like strep. In
Yeah.
fact, do you ever? I mean, you would not believe how many times that I've seen individuals that have chronic strep from when they were a kid
Mhm.
in their throat, in their thyroid,
Mhm.
and they have rashes all over their and they're like this, but they have Lyme, and I'm like, well, your body right now, this is the biggest indicator through your acupuncture system. Clean that up, then the Lyme comes to the surface. I get frustrated because I'm with you. I'm like, I want to go and get this right now and kill it and do it, but the body's like, instead of trying to kill,
Yeah.
strengthen.
Yeah.
So the body's like, well, swipe off the app to let the battery get bigger. But I'm with you. Sometimes I'm so surprised about how much parasites come up. And when people do come up with Lyme, there's another flip side. Lyme's big, but really that really wasn't the biggest case. Sometimes I find that Lyme was like an adjunct. It was like another layer, but underneath it all was like some other like I found people with different types of viral infection who finally confirmed, and you go, oh my goodness, that was the thing that kept them sick, and the Lyme came on top of it.
Yeah.
So
And
can we
mold.
get rid of these things? Yes.
Mhm.
Mold is huge. I mean, I don't know how many times you and I found organic acid tests that had people off the chain mold and yeast toxins. And
Yeah.
I'm encouraged though. Are you? I'm encouraged though that whenever we find Lyme and we start to clean the body out and start to get the liver to work, you can get Lyme to clean out of the body. Definitely,
Totally.
really well.
Yeah.
So
Yeah, I'm with
I'm
you.
with.
And when I started, I got discouraged too because I was like, "Man, like, I thought we dealt with these things." And then it's like this is the process of what we're talking about. If people aren't familiar, it's a process called methylation, and there's different facets in that. I did another podcast with Dr. J, who's our one of our big teachers.
Oh my god, you guys are two bombs. That's good. Go, I'm listening. Let's go.
Yeah, so we talked about the importance of, those pathways, because what is so difficult about Lyme and these types of infections is that they hide in areas, they mimic our immune system, they are kind of hard to also test. So when we talk about blood tests for people that may be listening and may suspect when we talk about things during this podcast, the testing is also really inaccurate for it. So a lot of people walking around have these infections and have no idea because their doctor said they don't, or it doesn't show in their labs. Um, so that in itself is a huge hurdle, and then once you figure out that you do have some of these infections, it can be a bit of a struggle because they hide, and so what we found with years of working with ourselves and with other people is that when we specifically do open up these pathways and open up these organs, then these things do start coming out. And you're right. We find other types of infections that the body has been hiding because it's like, hey, I don't have the energy for that right now. Can you please work on this first? And then I will free up and have some energy for to do some of these other things. And that's a protection too. So all these people that kill,
Yes.
your
Yes.
body is so intelligently designed that it's gonna conserve energy. So it's gonna hide all of that stuff, the metals, toxins, whatever it is. It's gonna hide all of that until it has the space to be able to do that and the energy to be able to do that.
Mm,
So that's
mm.
important too when you're going through this journey. Is
Ah, yes.
you have to build as you're
Because everybody out there,
in.
they have to know, like, whenever you and I talk to a patient, when you say that there's when you talk about methylation pathways and opening them up, I think that the hiding effect of Lyme, and for any of you out there that may not know, like when we're talking about Lyme infections, different Lyme infections, especially like spirochetes, so you can have Lyme Borrelia, which is actually the spirochete, and they all usually can move pretty quickly, especially the spirochete form.
Mhm,
Babesia, the protozoa, Bartonella, Ehrlichia, rickettsia, they all can get into the bloodstream and they can travel pretty quickly through the bloodstream as well. But they all have the ability to really move into your interstitial tissue and get between your cells and inside your cells. And that's the hardest part, is that when you don't realize, like with a Western blot test or an ELISA test, whenever you go get it, Doc Rachel and I are talking about, like, a lot of times you'll see that if they give you a standard test, they may only test for like 10 different species
mhm,
of Lyme itself. But we're talking about so many species of bacteria and parasites, and you could have hundreds of subspecies of those infections.
mhm.
I was looking at some different test kits, and they were saying hundreds of species, like over 115, 120 for Babesia. And the hardest part, and this is not to sound negative or sound like it's not, you can't get rid of it, but this is the point about you talking to Dr. Dunn, is that if you have all these infections that are subspecies and they can grow and they can hide in the joints, they can hide in the tissue, they can hide in your brain,
Mhm,
they can hide in your organs. I was discouraged because you'd have to take, you again, like you said, does my blood test show that I have Lyme? Now they have different types of tests, like they have different PCR tests for proteins that you can find out, like in different urine tests, and some of those work pretty well.
mhm.
But again, you can have different species, and when I got discouraged is when I was testing for my patients. Sometimes they'd come back and it's like, I know that because I do a lot of bioresonance scanning. I try to find a frequency range
Cool.
with the patient in their tissue that may mimic or may be representative of Lyme. So then I go, there is a frequency range within the tissue that shows that there's an infection there. I'll send you off to get it tested. And sometimes it didn't come back positive. I'm like, but I know they have it because there's every sign and symptom they've had that.
Mhm.
But then the great thing was, when I would start doing methylation, I would get their genes tested. And this is what Dr. Rachel and I are talking about, Dr. Dunn. It's like they would show all these different things that their genes needed. I would give them that, and then they go get tested, and then they would show for Lyme.
Yep.
And I was like, You talk about a brain buster, people
Mm.
always just like, I don't know what's going on. And when I went to the first session with Dr. Dunn, she says, if you get your vitamin D receptors working, if you get your liver working, your own immune system will kick up and start killing that stuff on its own.
Yeah.
It'll start pulling it out and start doing stuff. And that's why you're finding it. And I was like, that's what I was missing, and I was like, and now it's like, I just start people off doing some methylation and see what comes up on their test. So
Yeah.
if anybody out there suspects Lyme,
Yeah.
and can't get answers, try to find like Dr. H, find a good holistic methylation practitioner and get your liver checked and cleaned up, and you'll start to see results really well.
Yeah. So we'll go back for a second because some people might not know what the testing is. So traditionally, to test for Lyme or these other types of infections, the traditional like gold standard is the ELISA test or the Western blot test. Um, the problem with that,
Mhm.
as Dr. Chris has just mentioned, is that it only tests like maybe like 2 or 3 strands of Lyme. It may be less or
Yes.
more. I don't remember exactly, but they're like
Yeah.
strands from Europe, so they're not even strands from the US. And so, first of all, like he said, there's hundreds of different strands of this infection. So, if it doesn't show up on that one specific test, then they will say you're negative. The other thing that happens
Mhm.
with these types of tests, antibody tests, because we even have, the more expensive labs now that do wider range of antibody tests like IGeneX and some other, standardized tests, is that those tests test the presence of antibodies. Okay, but a person, say
Mhm.
for instance, I'm younger and I have strep throat or I get chronic ear infections, but actually I have some of these other infections already, and I take an antibiotic. The antibiotic wasn't enough to kill the Lyme and infections, but it was enough to create an antibody response. And so from then on, doing antibody testing for that, it's always going to show negative. And so that can also be complicated for people too if they don't know, oh my gosh, like I actually had it all that long time ago, but my labs are still not showing it. So what we're saying is we have labs, they work sometimes, they don't work other times. You have to have other ways of testing for these really stealth things. You do bioresonance testing, which is awesome. Um, I do other types of kinesiology testing. One is called Lyme Stop, which is a basically energetic form of testing for Lyme and other types of infections. And we go a lot off symptoms too, because we know what it's like. So,
Yeah.
that's one of the hardest parts about this, just the diagnosing way is number one, the testing is really bad. And then number two is it can differ for different people. So it's pretty awesome. It's honestly awesome when people do get positives in the labs because I'm like, oh wow, awesome. Like it
Totally. Like I mean, when it hits you, you're totally surprised. And like it showed. I'm glad it showed because of all the, I mean, because there's so many, false negatives out there. Like there are people that really have it, and they that stuff's burrowed into your tissue, and it's in your joints or
will
in your
be,
brain, and they're not just floating around the bloodstream, and you're not going to get that in the blood test. I mean, Limestop's great. I think they're out of Idaho. They do great work out there too. I mean,
yeah.
it's really one of the things that that's most people have said is because they'll say something like, okay, it can never be eradicated. Well, things are hard to be eradicated if they can't be found. I mean, I understand that too, and I say that with my heart with it because it's
Yeah.
tough when people are going through it. But like you said, there's different testing. The hardest part is now, like, if people out there, if you get a negative, I just say don't lose hope to find it, because you could go to one lab, and I'm not putting down any lab. I'm just saying, like, one lab could be like so you went to LabCorp or something, and they test for 7 strands or 6 strands.
Hmm.
Then you go to the other lab, another hospital, they may test for only 5. And if you don't get 4 positives
Yeah.
out of those 4 different species, they won't say you have Lyme disease. You may get one that says positive, and they go, they got a little bit of Lyme. Here's doxycycline. You go ahead and take that. You should get rid of it.
Hmm.
And you know as well as I do that whenever you take an antibiotic and that Lyme or that species of Lyme infection or co-infection, they're smart,
Yeah.
and they will create their own ways of like making biofilm, or they'll try to find their own way, and they'll adapt and they can escape. and they can hide.
Mhm.
And now, whenever I send people, like, they have IGenics, and you have now I love DNA Connections. That's a pretty good one. You have Vibrant America. There's different ones out there,
Mhm.
but I'm with you. I think that if you can find a doc that can look at that, and then also have somebody can do like any type of energetic bioresonant frequency scanning to
Mhm.
try to get as much information out of the tissue, that's another way I would go. Definitely.
Yeah, you gotta look at, like, the tissue level too, and like we both said as well, sometimes even with the extra testing that we have, things don't show up right away. So you have to open up the liver, open up the bowels, open up the kidneys, and then it's like, "Ooh, there's a party happening in there," and then you can actually find
That's
some of
exactly what happens.
these. It's
Uh,
exactly what happened.
Especially like whenever you find it, like, I'm with you. Like, sometimes, like, whenever I check somebody, like, I always try to, check their, in Chinese medicine, check which organs are most deficient.
Sure.
And man, if you find like the kidneys or the adrenals are really low, or the bowels, and you get those things rolling, you'll start to see signs. And not saying you want them to increase, but you start pushing that stuff out, like, you uncover, and the body gets a little stronger, and then they'll start going after the Lyme, and people get a little more symptomatology after you start cleaning it. But if you do it really well and build enough energy, like you say, build their mitochondria, the good thing about that is that they have enough energy to go and kill things off and to detoxify. So they don't go about any Herx reactions. That's great.
Yes, that's a huge point, is if you are currently dealing with Lyme or you've been working with someone and you're just consistently feeling awful and never feeling better, then that's not necessarily the right approach to go through. You want to rebuild as you're also killing these things at the same time. Because additionally,
Mm,
we want to work on that adaptive immune system too. We want to work on remembering some of these things so that if we're ever exposed, that we can deal with things quickly and be exposed to that.
mhm,
So, okay, so I'm gonna shift for a second. Um, in your treatments of what you had,
mhm.
what would you say was like a specific timeline for yourself that once you added in the methylation or whatever what it was your secret sauce to get you to that point, what was kind of the timeline for you to be able to recuperate completely?
Well, that's a great, and I always try to give hope. I mean, like, whenever I was doing the regular, like, killing off Lyme, I was working. I was working in this middle of it too, and like, I
Mhm.
probably should have taken time off. I really should
Sure.
have. When I started doing like heavier tincture therapy, it was like I was taking some tinctures, but I was taking a few herbs, I mean, vitamins and supplements, like just a few here and there, but I was just doing a lot of tincture.
Yeah,
So I was saying it was about a year and a half of killing off stuff because it was just so built up in my body.
yeah.
After I started the methylation, I saw results within 3 months.
Mhm.
Like 3 months, solid 3 months. I was taking my supplements. I felt like my energy was starting to come back. And don't get me wrong, like, the killing off we killed off a lot of things, but I started noticing that I was starting to get less heart palpitations and less jaw pain. And I got a good story about that too. I'll tell you about that line. But I 3 to 6 months, 3 months, I really started feeling my legs. I was like, 2 months, I was like, that feels pretty good. 3 months, I was like, huh. 6 months, I was like, wow, I don't have chronic headaches. Like, they're gone. And after a year, with doing methylation and really sticking forward to it, I had a little bit of digestive issues, but that was just, I had to keep working on that.
Were you doing
But
killer
I mean,
stuff
that's when I said
were you doing killer stuff in that too, or just straight, like, methylation work?
I did a little bit of killer. I incorporated, like, I did some tinctures within there, and I try to do like single ingredient, but I did stick with a few multi tinctures
Got
to
it.
help kill off during the time. But I made it less. I didn't try to.
Mm,
Before I was taking tinctures, I'd take like big dropperfuls or like spoonfuls, and that was no bueno
no.
because I was just like you. I would have Herx reactions, and I would be driving down the road, and I literally thought my cheeks were to pop open because I had such bad infections. Remember, I had pockets. I had my wisdom teeth cut
Mm,
out when I was a kid,
mhm,
and they found cavitations in my jawbones.
mhm.
So I started taking the tinctures. Kudos to Dr. Lindsay's tinctures. I took those in almost 4 to 5 months. Went back to the doctor to go get another CAT scan to see what I was going to have surgery to clean them out, and they were gone because I was feeling the stuff drain out of my cheek. Like, I mean, I would be hurting, but I mean, it cleaned them out,
Wow,
and my bone grew back. It was amazing.
that's amazing.
But I about 3 to 6 months. Yeah. How about you? I mean, like, how do you feel
Who's
like when you
Dr.
started getting like you already said you
Who's Dr. Lindsay?
huh?
Who's Dr. Lindsay?
Lindsley,
Oh,
Alan Lindsley. He's up in
yeah.
Wisconsin. Hmm.
Okay. And he's
He's good. He works with Stelcor now and stuff like that. He does a good job. Yeah.
okay, yeah, 'cause
He's one of my mentors.
Cellcore has some good
He's mega smart.
antibiotics. Yeah, yeah. Yeah,
Mm.
Cellcore has some good
I would
antibiotics too.
yeah, they use a lot of his formulas. They have a lot of their good formulas there too, so it's great. Hmm.
Yeah, that
I mean, I think that whenever we have Lyme infection, that individuals see that the severity of it, um, and for all those who lose hope, I mean, really, prime example. Like I thought, man, is it ever going to stop? I
mm,
don't know how you felt, but sometimes I got suicidal at some points because
yeah.
I thought, well, I'm only down to 4 to 5 people a day treating, and I go, well, I can't keep going on like this. And it affects your dopamine and serotonin levels so bad. So guys, if you listen to Dr. Dunn's podcast with Dr. Hamill here, you know that if the liver is off, it affects your serotonin and dopamine levels because there's certain genes that help control the breakdown of serotonin and dopamine in your brain. If your liver is congested and toxic with an infection, your brain will not break down serotonin and dopamine if you have the genetic markers that determine that. And I do. Like, thanks to my parents gave me like not so great vitamin D receptors, and it gave me the MAO genes like my mom has that don't break them down really well, where I'm not breaking down serotonin, and then I get chronically depressed.
Mm,
So now, like doing the methylation, taking the right vitamins and the right minerals that were specific for me through my gene testing, um, man, my brain got better, and I was like, oh, I don't feel like I could go to sleep. I don't have insomnia. I don't have depression or anxiety. So
yeah.
there is hope, guys. You can do well. You can heal.
Yeah, there's so many different things out there, and we're just two of a wide sea of different practitioners that treat Lyme and have overcome many things. So
Mhm.
if something doesn't work for you, don't give up. There's so many different options and availability. We're just sharing with what worked for us, and what works for our patients.
Mhm.
And, I mean, in the spectrum of Lyme, like a lot of Lyme doctors, traditional and alternative will say like multiple years until you get rid of it. So for us, it's like we want to bring that hope level to that. Hey, like depending on the case, when you work with your unique biochemistry and you figure these things out, you can actually purge them pretty quickly, at least a good majority of them pretty quickly. Um,
You can.
yeah,
You
you,
can.
you can do that pretty quickly. And I'm thankful that so my like depression, suicidal stuff was like pretty early on when I didn't know what I had because I was bedridden for like 2 years. So that was it for me. Like I had lost all my friends, like I was back at home with mom and dad, which I was so thankful for, that community. Um but once I had gotten that, like, sliver of hope, so Dr. Smith, he's the one who created Lyme Stop. He was one of the first doctors I saw alternative for Lyme, and he's trained me with
Mhm.
some stuff now. Um, Once I got kind of that sliver of hope where I started, seeing that shift, it was like, "Okay, now I'm on." But it wasn't up until that point because I had done so many things, and I know people have come in with that. They've done so many things, and they're like, "If I could just see, like, some sort of shift," and that's where that momentum happens, and it really is that momentum that propels you to the next step. So for me, that was like, okay, even with him, like, I got better maybe like 50, 40, 45%, but I was like, "Okay, well, I'm better than where I was, so now I gotta learn some more to get to the next step." And that's important because if you gotta celebrate, those parts where you have overcome and then, get to the next phase. A lot of it for me, like I said, was breaking off mental limitations as well. Because like a lot of those
Yes.
depressive and that stuff, yeah, I had to heal my gut, like, took many years to do that because of the antibiotics. Um, Definitely struggled with stuff for there, but it wasn't until I broke free from those mental chains that I don't struggle with that stuff anymore, which is amazing. But
Mhm.
it is a journey, sometimes there are many different levels to healing. Infections are just one level. Um, but there is so
Hmm.
much hope and so much availability for different things, and I know you experience that too in what you do.
I do. I think that
Yeah.
the hardest part um, is realizing and having the mental programs and the feedback loops that are in your brain and in your body that you've learned from Lyme that expose themselves.
Mm,
And I say that for all of those out there that are still feel like they're stuck. The thing is, in Chinese medicine, it's always about, they say balance, the yin and the yang, the qi, and they talk about energy, and we're all about that.
mhm.
And when you say like that, your organs take on a lot of pressure, and your organs do a lot to help clean you out. And we all have to think about how an organ, when it gets bombarded with Lyme or infection, if the liver is the case, the colon, it starts pulling energy from other organs to try to help itself out. The thing is, like when you do that, your organs help you process the emotions. And the other thing is, if the organ's tired and fatigued, you won't process the emotion that organ was meant to. Like the liver has anger,
Yeah.
and the gallbladder with frustration. The thing that gets me too is that the body learns. I hate to say, is that we adapt to the Lyme,
Mhm,
and so you adapt to the Lyme,
mhm.
and your body gets used to it, and your brain sets up a looping mechanism with the organ saying, "Oh, it's okay. He's around. That guy's been around for a long time. It's normal. I don't have to deal with it."
Yep.
But then, like you say, you go to Lyme stop, and some inherent intelligence within your body says, "This ain't right. I cannot do that." And so you start taking stuff, like you said, and it starts to clean out, and your organ goes, "Oh, okay. Like little pressure's off me
Mhm,
right now. I can do a little bit of what I was supposed to do."
mhm.
Then you start to connect more with your emotion, connect with your mind, and you go, "Yeah, this isn't me. This is not me at all. This is like," and you start to crave, like you start, like you say, you got 45% with Lime Stop, and you got 55%. You go, "No, I got to bump up." That's what I had to do. Like I got to certain points, like, no, I could either make me or break me. It's like I'm either going to live or I'm going to die, and I'm like, I'm going to just keep going forward. Now,
Yeah.
it took time, and you say a years, but it's not for the faint of heart. But like you said, if you this is the crazy thing. We learn through our experiences, but now, like I see people come in the office, and if I help them feed their genetics, they can get rid of a lot of stuff pretty quick.
For
And
sure.
and I'm kind of jealous.
I was gonna say
Some
that.
people
I
come
was
in and
like,
like,
yeah.
yeah, like I get jealous. I'm like, 8 months, like, yeah, you're doing great. Like I can't. I said, you
Right.
need to do this for 6 more months. Just take this regimen and then go back and get tested again and see if you have it. But they're like, yeah, I'm feeling great, doc. And I was like, it took me, 3-4 years just to get normalized. You know what I mean? Like just
Yeah.
really feeling better.
Yeah.
But I'm with you. But that's exactly right. But it is hope because it worked. I'm feeling better now. It's great.
Absolutely. And I don't know if you do this in your practice, but one of the things I find really helpful is because I kind of seen a wide spectrum of things where I've seen people who have done lots of different things for Lyme and they come into my practice. And then I see other people where I'm, the physician that diagnoses that for them or suspected it. Um, but I know you kind of mentioned this briefly in the beginning, and I don't know if you do this in your practice, but when, I suspect a Lyme or co-infection of that sort, one of my biggest things, and this goes
Mhm.
for other things too, is I never tell them like they have Lyme. Um, or
Mhm.
like I will mention it, but a lot of the people that come in that have done stuff, I was like, you gotta disassociate from this diagnosis because then you start.
Mhm.
Part of my journey too was once I had that diagnosis, I attributed literally every single symptom that I felt to that diagnosis. And another practitioner I saw halfway through that process was like, "Yeah, this probably isn't from the infection. This is because your airway is all messed up and you've got some other structural problems and stuff like that." I was like, "Oh, but I thought it was just the infection, and that's what everybody tells me." So that's important for me too. I don't know if you experience that with your patients, but it's important for me to work with the patient too and say, "Yeah, you may be having some of these symptoms and some of these infections, but do not have your amen to that diagnosis. Don't give it power because that was a process that I had to work with releasing for a while that it's not really a part of you. Your body's doing an amazing job of dealing with it and you're expressing some of that. But when you take that on and it becomes a part of you, it can sometimes be so limiting and it can block your healing too. So I don't know if you go through that process with your
My
patients.
Yes, I always tell them, don't make it your identity. Like, don't make it your identity, because um, it you just hit it nail on the head. It's like a lot of times when people start to create that neurological link between, like you say, a symptom and saying that it is Lyme, and then it's like, I have Lyme, and it's like, I always tell people, watch their words. Like, you experience Lyme, you're experiencing Lyme, but I have Lyme disease, I've got Lyme, and I'm like,
Yeah.
they start to think that that's their only, that's them. And like, anytime now they walk outside, and I'm not putting them down, or I know it's hard. Like, oh, I get breathing issues. Well, I've got allergies because of the Lyme disease. And I'm like, and then I try to definitely say, well, you're experiencing Lyme, but I'm like, you could have Lyme and have another infection or have an allergy that's built upon, but it's just that your genetics are weak and they're expressing themselves because you've had infections.
Yeah.
And I work hard with each patient, like you said, to get them on emotional freedom technique, or EFT, or NET, or like neuro-emotional technique, or doing certain types of acupuncture to help release the emotions within their body. To me, it's probably as important. Like, when I first get that basis, like if they
Mhm.
start to identify with it and it becomes their whole persona, I send them to one of my friends who's a psychiatric nurse practitioner who does a lot of the
Mm.
kinesiology type techniques to help release and do different things with the brain. And so I try to incorporate just as much, because patients, once they create that feedback loop with every symptom, the hardest part is that they go into PTSD.
Yeah.
Like, after they start to get rid of Lyme and they can't find it, as well as I do, they'll go, I had patients, like, that's a good example about the throat.
Mhm.
And they think, well, it has to be Lyme or something like that. And I was like, well, my airway feel like it's clogged up. And I was like, well, I can't. You may have to go to ENT. So they went and got things checked out. Well, I kept finding H. pylori,
Mm.
and then I said, well, you could have another infection, but I'm not sure what it is, because I couldn't find it.
Yeah.
E. coli.
Mm. Mhm.
She had E. coli, and it
Mhm.
scarred her esophagus. And
Mm.
she thought it was all like, and it could have, you could be weakened from the Lyme, but I was like, is E. coli? Gave her rosemary, 6 to 8 weeks of just cleaning out. Went back, no more scarring. And I was like, not trying to brag about it, it's just like, she made that mental connection, like, this is. I'm like, no, it's don't it's not. So I work hard with emotions on individuals to really clean up their emotions first.
Yeah, and this is kind of, I guess you could say, a clinical pearl, but when we first talked about, didn't wanna see people at first, one of the things that I encourage people to walk through, this isn't for every patient with it, but especially if you have any type of diagnosis and you've seen multiple doctors, and the thing that's tough about Lyme, and I know this exists with other things too, is that you don't feel heard, you don't feel listened to sometimes in traditional medicine. You're told you're crazy, like the symptoms that you're experiencing aren't real, which was my experience for a while. And um, you know, God revealed to me that I had to go back and I had to forgive those doctors. And I walked through that with a lot of my patients. I'm like, you got to go back and you got to forgive them because, whether they knew it or not, like it's not their fault that you're sick this long. So, that can also be a point for people to go back in this journey. And if you've had Lyme for a year or 5 years or 20 years or however long, and, you just gotta go back and you gotta, like, release that, and you have to let it go because those limitations of unforgiveness are what do block people, and then they attach to that diagnosis as well because 'cause they're like, "Oh my gosh, I found it, and now everything's this." So, that like you said, the emotional part is very big, and you have to find out where those blocks are too that are blocking your healing, especially if you've
Right.
had something chronically, there's always emotional blocks. Um, so, that's part of what
I always think of the emotion ones. I mean, too, like, when you do that, doc, I mean, like, do you ever find, like, sometimes whenever I get first start off with a patient, I always try to check their pulse points. I do different things with acupuncture, and I usually identify that, or any frequency testing, kinesiology testing, and I go, if I ever find an organ system that is so tired, like the heart or the muscles of the heart or the spleen or the lymph nodes, I always go in and I start to try to investigate and see if that main organ had a lot of emotions that are particular, related to that organ. Because we don't realize, like, you set yourself up, and when you're a kid or young, you have trauma. it just allows that organ to become a big basis for the infections to run to. It's like an abandoned house.
Mhm.
House gets abandoned, it gets broken down. Hate to say it, where do the robbers and all the people that just sort of want to just go in and just they sit around in that area? And so usually the cops just walk on by because it's just an old dilapidated house. It doesn't need my attention because nothing's good is ever going to come out of it. It's what happens to your body. Like a lot of times, the organ gets really tired, gets fatigued, and then those critters go in there and they camp out there. And the body's already used to being weak in that organ because it's adapted. It's thinking like I had this emotional trauma.
Mhm.
I'm used to it.
Mhm.
So it's to me, it's like you're right. It's an investigation game when docs and doctors and healthcare practitioners have to look into Lyme. But to me, it's like seeing patients who get better and see them, and even referring to other people to help them get better even faster than with me. It's a blessing. It's really a blessing that God has given to us.
Yeah, it's so rewarding. And I love that analogy that you just used. And that's one of the things I love about you is you're just such an awesome educator and teacher, and you take these complex things and you make them understandable. So I'm thankful
Thank
for your
you.
work and how you do that because it helps a lot of people for sure. Now, as we kind of come to a close here, I think you've probably already mentioned it or we've already mentioned it. Um, but what do you think is one of the biggest things that people miss in the um, expression of these types of infections that limits them?
Say that again. Like, what do I say? Say that one more time. Sorry, it broke
What's
up.
one of the biggest things that people miss with
Oh,
Lyme and the expression of these infections?
wow. Um, okay. I think one of the biggest things they would say miss, like symptomatology, or one thing that they do not check is the rebuilding of the kidneys and the bladder. Now, this may sound a little technical, but to anybody out there, if you've ever had chronic UTIs, chronic yeast infections, or bladder infections, the thing is when you're younger, you just automatically suspect, it's like, I had yeast or I had bacteria.
Mhm.
Well, Lyme's a bacteria, and they find that Bartonella, Babesia, especially Borrelia bacteria love the bladder. And the thing about it is, everybody focuses on the liver, and that's great. But whatever the liver can't handle, it's going to jump over into the kidney, so your body will try to pee it out. So then the kidneys get infected with Lyme infections or some of the bacteria, and so does the bladder. Now, the thing that we miss is that the kidneys is where the adrenal glands sit on top of. So when the kidneys get tired, the adrenals get tired. And so people get in chronic fight or flight.
Yeah.
So people don't realize, like, whenever there's bladder fatigue, you'll have overall fatigue in Chinese medicine, and you'll have fight or flight and anxiety. And so when people say, well, I just have a UTI or something of that sort, and they say with Lyme disease infections, most of the time people are like really focusing on the liver and just saying with the heart and getting the bowels clean. I'm like, clean the kidneys.
Mm.
I guarantee you, if you clean the kidneys and get the bladder working, you'll give your body energy. And here's telltale signs. You have poor memory loss, because the kidney dysfunction causes memory loss in acupuncture because of how the kidneys help your body create red blood cells. You'll have anemia, and you'll lose your hair because the bladder meridian runs right down the body. So I'm just telling people out there, whenever you have Lyme and you telltale signs of what people miss, if they think they have Lyme symptoms and they start to go, man, I have burning urination, I get super tired around the late afternoon, around 5 o'clock or 6. Kidneys, bladder, please check that. I'm telling you, you can heal a lot with that.
Woo, that was an awesome tip. Thank you so much for that. I hope people captured that because that's
Um,
really important. Um, let's give a little plug to you. How do people find more about you? Because
yes.
you're
Plug.
you've been waiting for this all day. Uh,
No, whatever.
um,
Uh,
how do people find you? How do they follow you? You're in Nashville, right? So if
yes,
they're
I'm
in
in
the
Nashville.
area, how do they find you?
You can hit me up at Dr Motley, which is all spelled out. Dr Motley spelled out, and then that's at Dr Motley on Facebook as well. You can go to my website drmotley.com, and you can do spelled out or drmotley.com, and you can find me there on Instagram, Facebook, and I'm doing a little bit of TikTok. I'm trying to start that. I need to try that.
I'm with you.
I got Dr Motley there, so it's great, and then at Dr. Motley on the website. So you guys, you can check it out. I mean, I was saying that at the very beginning, but just as long as we get good information out there. And I really appreciate it,
Mhm.
Dr. Hamill. I appreciate it so much. And hope we get to talk and chat more soon and keep in touch more. I really do mean that.
We definitely will. Thank you so much for taking the time. I know you're super busy. We're super lucky to have you.
Oh,
And
oh, I'm glad to be on here.
for anyone tuning in, we will catch you on the next episode. Have a great rest of your day.